Hi, I'm Dr. Mejia. I want to talk to you about shoulder pain after a vaccine. Let's face it, it is common to have some discomfort in the shoulder after a vaccination, which is described as a soreness with raising the arm away from the body, and it can linger for a day or two, and then it dissipates, and there are no long-term consequences. However, every year during the flu season and the flu vaccine, we see a number of patients that come in with long-term effects or complications from a vaccination that can last weeks and sometimes even months. And now that we are facing more and more injections due to the COVID pandemic, not only have we seen a number of patients with shoulder complications after the injection, but we also expect to continue to see them over a course of time. So this is something that I want you to realize is a real thing. There is a term for this. It's called shoulder injury related to vaccine administration, or SIRVA for short. It is recognized in the CDC's Vaccine Adverse Event Reporting System. So it is a real thing. There seems to be a common thread in some patients where they report that they felt the injection was a little bit high up in the shoulder as opposed to in the more fleshy or muscular part of the shoulder. So it's important to have that awareness when a vaccine is being administered. Patients will present with their symptoms usually after a few days after the vaccine, or sometimes even immediately, but the pain lingers and continues and can even worsen over the ensuing weeks, affecting them with daily activities, using their arm away from their body, raising the arm overhead. And very commonly, they also present with progressive loss of motion. Some patients will present with a frozen shoulder. It is helpful to treat patients with this condition earlier rather than later, and it is helpful to have that recognition. So the goal is to create this awareness so that if this is you or somebody that you know, they will seek help and get treated. Most of the time, surgery is not indicated, although we have operated on a number of patients that developed significant motion complications and needed surgery. So hopefully this is helpful for you. Thank you.